Die Kurve ist flacher geworden. Es bleibt nach wie vor so, sie muss so sein, dass sie unser Gesundheitssystem nicht überfordert. Und wir haben Modellbetrachtungen gemacht. Wir sind jetzt ungefähr bei diesem Reproduktionsfaktor 1, also einer steckt einen an, der natürlich auch nicht, das kann ich immer nur für eine Infektionskette sagen, ob einer einen ansteckt, das ist dann ein Mittelwert, aber es ist ungefähr einer steckt einen an. Schon wenn wir darauf kommen, dass jeder 1,1 Menschen ansteckt, dann sind wir im Oktober wieder an der Leistungsfähigkeit unseres Gesundheitssystems mit den angenommenen Intensivbetten. Wenn wir 1,2, also jeder steckt 20% mehr, 1,2 an, also von 5 Menschen steckt einer 2 an und 4 ein. Dann kommen wir im Juli schon an die Belastungsgrenze unseres Gesundheitssystems und bei 1,3, das hört sich nicht viel, wir kommen von 4, 5 Ansteckungen, 3 bis 5 Ansteckungen. 1,3 sind wir im Juni an der Belastungsgrenze unseres Gesundheitssystems. Daran sehen Sie also, in welch kleinem Spielraum wir uns aufhalten. Und die ganze Entwicklung basiert darauf, dass wir davon ausgehen, dass wir eine Infektionszahl haben, die wir überblicken können, die wir nachverfolgen können und dass wir mehr Schutzkonzepte haben und durch die mehr Schutzkonzepte auch mehr Lockerungen machen können. Aber es ist ein dünnes Eis, wie Herr Tschentscher gesagt hat, oder eine fragile Situation oder wirklich eine Situation, in der Vorsicht das Gebot ist und nicht Übermut.
Well, since mid-March, when the first deaths were recorded, more than 16,000 people have died just in UK hospitals, whereas in Germany, the total number who have died from the virus has been just over 4,500. And all that despite the fact that Germany only locked down the day before we did.
A sight not seen for many weeks in the North German city of Hanover. The streets beginning to fill, some shops, smaller than 800 square metres, gradually reopening. We filmed the Leuhagen and Paris bookshop as it came out of hibernation this morning. Many of the shelves moved onto the pavement to avoid crowding inside. Strict rules on social distancing put in place. But the most important image, the triumphant "We are open" sign in the window. The owner, Miriam Drahler, stands behind a till protected by a thin sheet of perspex, happy to do what it takes for as long as it takes, as long as her business is open.
We are all very excited. We are excited because we don't know how many people are going to come, how many customers, and in what kind of mood they are going to be, if they like to be here, if they like to talk with us.
So how has Germany managed to get ahead of almost anywhere else in Europe in terms of easing the lockdown? How have its hospitals managed to have spare capacity, like this intensive care unit in Munich, despite more than 150,000 cases? So much so that they've taken 200 patients from elsewhere in Europe and shipped 40 ventilators to the UK. The answer seems to be that they started with more than 3 times the number of ICU beds, prepared early, and then tested, developing a test kit way back in mid-January, and since carrying out close to 2 million.
We feel convinced that the strategy of intensive testing and restricting social contacts is working in Germany. But I personally feel that most of the countries who initially followed a rather open course and not restricting much and not testing much are gradually switching into the other direction. You see this in Britain, you see it in the US, and I seem to understand that it also goes slowly into this direction in Sweden as well.
It's not just that people, as here in Berlin, can queue at a local testing clinic if they feel they may have been exposed, or go to drive-through centres like this one in Dresden, where results are promised within 10 hours. In the picturesque city of Heidelberg in Western Germany, an ITV News team filmed medics preparing to visit COVID-19 patients who are self-isolating at home, using a fleet of former school buses so they go to patients rather than patients come to clinics or fill hospital beds. With no apparent shortage of PPE here, they test to confirm the diagnosis, then monitor to ensure anyone deteriorating is moved to hospital quickly. They believe these teams, many made up of volunteer medical students, have saved many lives. The German government says it will monitor the relaxation of rules very carefully. They're acutely conscious of the dangers of a second wave of infections, but so far claim some satisfaction in the way they've stayed on top of this crisis. James Mates, News at 10.
Die Kurve ist flacher geworden. Es bleibt nach wie vor so, sie muss so sein, dass sie unser Gesundheitssystem nicht überfordert. Und wir haben Modellbetrachtungen gemacht. Wir sind jetzt ungefähr bei diesem Reproduktionsfaktor 1, also einer steckt einen an, der natürlich auch nicht, das kann ich immer nur für eine Infektionskette sagen, ob einer einen ansteckt, das ist dann ein Mittelwert, aber es ist ungefähr einer steckt einen an. Schon wenn wir darauf kommen, dass jeder 1,1 Menschen ansteckt, dann sind wir im Oktober wieder an der Leistungsfähigkeit unseres Gesundheitssystems mit den angenommenen Intensivbetten. Wenn wir 1,2, also jeder steckt 20% mehr, 1,2 an, also von 5 Menschen steckt einer 2 an und 4 ein. Dann kommen wir im Juli schon an die Belastungsgrenze unseres Gesundheitssystems und bei 1,3, das hört sich nicht viel, wir kommen von 4, 5 Ansteckungen, 3 bis 5 Ansteckungen. 1,3 sind wir im Juni an der Belastungsgrenze unseres Gesundheitssystems. Daran sehen Sie also, in welch kleinem Spielraum wir uns aufhalten. Und die ganze Entwicklung basiert darauf, dass wir davon ausgehen, dass wir eine Infektionszahl haben, die wir überblicken können, die wir nachverfolgen können und dass wir mehr Schutzkonzepte haben und durch die mehr Schutzkonzepte auch mehr Lockerungen machen können. Aber es ist ein dünnes Eis, wie Herr Tschentscher gesagt hat, oder eine fragile Situation oder wirklich eine Situation, in der Vorsicht das Gebot ist und nicht Übermut.
We have right now, the best testing system in the world.
We're the ones who had to spin up testing. I asked over and over again for testing from the federal government. They kept saying they were going to deliver millions of tests across the country. They haven't done that. We've gotten very little help from the federal government. It's fine. I've given up on any promises that have been made. I hope something will get delivered from the federal government, but I don't expect it anymore.
It will go away, just stay calm. Typically that will go away in April. We're in great shape though. You treat this like a flu. It's going to disappear. One day it's like a miracle, it will disappear. So healthy people, if you're healthy, you will probably go through a process and you'll be fine.
Do you believe it's inevitable that the coronavirus will spread across the country?
No, I don't think that's inevitable at all. We're in great shape. Compared to other places, we are in really good shape. Doing it the way we're doing it is much better. It's really much better.
Europe's biggest economy is undergoing Europe's biggest lockdown, though for not much longer, with many shops in Germany allowed to reopen next week. So decided Chancellor Merkel, a scientist by training. She had spoken to all 16 of her state governors, and afterwards she talked of fragile success.
We've achieved something that was at first in no way certain, namely that our doctors and nurses, all those in healthcare and the hospitals, are not overburdened. But I must emphasise this is a fragile, intermediate success.
As for education, well, Germany plans to follow neighbouring Denmark, which began opening schools today. Though the Germans will prioritise those sitting exams, and they won't reopen their schools till May the 4th. Germany's first big virus outbreak was reported after a carnival here at Heinsberg, near the Dutch border. At first, the Germans had almost 3 times more cases than the British, but their lockdown began about a week ahead of the UK's.
We did the right thing, honestly. So our authority closed schools very early, closed events, closed pubs, and so on. So we were a bit earlier than, for example, the UK and the Netherlands and Belgium.
It also helped that many early German infections were from European ski resorts. That meant that their average age was lower, and so they were more likely to survive. More significantly, Berlin's main hospital tracked the news from China and developed a test for the virus as early as mid-January. The more tests, the quicker you can isolate or treat infections. The pharmaceutical giant Bayer filmed for us this lab, which can perform and return up to 1,000 tests a day, while the UK has blamed shortages of labs, chemicals and swabs.
If you test more, you find more people. If you test less, you have a lot of people that are infected, but you don't register them. And that is also dangerous.
More labs are testing, and so are more GPs. This one told us there's no shortage of kits, and that she's proud of the German government's response. Germany's conducted 1.7 million tests, more than 3 times as many per head of population as the UK, which has carried out almost 400,000. Germany started with 621 acute care beds per 100,000 people. In the UK, it was just 228. Germany's death rate is 2.5% per 100 confirmed virus cases. The UK's 12.8%. Over 3,200 deaths have been reported in Germany, compared with almost 13,000 in the UK.
We all know that Germany got ahead in terms of its ability to do testing for the virus, and there's a lot to learn from that, and we've been trying to learn the lessons from that.
It's sad that I have to say this, but the UK government underestimated the threat of corona in the beginning.
The Germans are so flush with intensive care beds that they've accepted patients from France, Italy and Spain, and they've donated 40 ventilators to the UK. There have been mistakes, with Germany's health minister apologising after he failed the social distancing test inside this packed hospital lift. But this is a country which responded faster and more effectively, and is now on its way out of lockdown much quicker than most.
Well, we can debate whether there are any shafts of sunlight, with talks of the lockdown beginning to ease in some places. But here in the UK, the bad news on the high street continued, with 2,000 jobs going at brands Oasis and Warehouse. Well, to talk about the state of the economy, I'm joined by Mariana Mazzucato, Professor in the Economics of Innovation and Public Value at University College London, and by the Conservative MP and former Economic Secretary to the Treasury, Harriet Baldwin. Welcome to you both. Harriet Baldwin, you were at the Treasury Select Committee earlier. What was the mood there in terms of the UK's economic outlook?
Well, I think the report yesterday from the Office for Budget Responsibility was very sobering, because it shows the sharpness of the decline that the economy is going through at the moment as we lock down. And today we were focusing really on the bridge that both the Bank of England, but also the regulators and the Treasury have put in place to try and help everyone through this period so that we can come out of the lockdown in a way that gives the maximum chances to our economy to recover from this sharp downturn.
OK. Mariana Mazzucato, you've argued that this pandemic is actually an opportunity to rethink capitalism. What does that look like?
Well, I think that there's different issues here. One is that both what we've seen, before the crisis, during and after, can give us all sorts of lessons. In terms of before, those workers that are being most affected are those, in fact, in the gig economy, which we've known for a very long time is problematic, but it has been revealed more than ever. As Martin Luther King once said, you judge people during hard times, not good times. And I think the way that we've actually set up our work structures, which make people very, not resilient to a crisis like this, but also the fact that we've underfinanced actually organizations like the NHS. The cuts, I think, since 2015 have been over 1 billion, means that when you have a crisis like this, you can't just throw money at it if it, in the meantime, has become weakened. So we need solid and resilient structures in both the private and the public sector. And very concretely, there's a real opportunity now to frame, for example, the bailouts in such a way that actually have conditions attached which get us the kind of, if you want, corporate governance structures, which are more dynamic, but also that are really reinvesting income back into production instead of being siphoned out, for example, through share repurchases, but also some of the ways that the government is planning on helping companies, for example, by helping the wage bills by about 80%, that has to be conditional on the companies not laying off the workers themselves. And it's incredible that that level of detail hasn't actually been structured yet. And that's going to be a problem because you shouldn't just hand out money.
Let me put that to Harriet Baldwin then. Do you agree with the idea that there should be conditions attached to bailouts for companies?
Well, I would strongly disagree with the point that it's not going to be capitalism that gets us into the economic recovery. Of course, we're going to need a vibrant private sector. And I think it's very important to emphasise how we have actually been investing in our NHS throughout this period, and that the NHS is getting all the funding that it needs and has been, I think, responding incredibly well to this challenge, and we thank them for all the work that they're doing. I do agree that we've got to work collaboratively with other countries in terms of development on the science, and I think that we can all learn from each other as scientists across the world, and with the UK in a leading role in terms of our contribution announced today to the Coalition for Epidemic Preparedness, for example. I think there's an important role that we can play internationally to research these things together and to find a vaccine and cure for this terrible new disease as quickly as possible.
Mariana, you heard there the reluctance to attach any conditions to a bailout. I mean, you're not going to be able to make this case, are you? Governments aren't going to take it up.
Yeah, I mean, just to come in quickly on the NHS, everybody's thanking the NHS workers. Of course they should be, but they also have to be strengthened. You don't send soldiers to the battleground barefoot, right? So the weakness in some ways of our public health system, as great as it is, and yes, we all clap on Thursdays, it is an insult to simply clap and not also to strengthen the system itself so it can continually, systemically actually be strong. So it will be prepared also for the next crisis, because unfortunately this won't be the last. Now, the conditions, you know, there's many countries that are talking about it. This is about doing capitalism better. It's not about capitalism or, you know, socialism. So across the world, there's different types of conditions being attached, and it's fundamental in order actually to drive the kind of economy we also want post-COVID, which is a more inclusive one. You don't just come in and bail out companies, you actually help them transform in order to also deliver the kinds of working conditions. But also, we shouldn't forget that about 2 months ago, we weren't just thanking, you know, health workers, we were thanking the firemen, the flood workers in Venice. So there's also this whole climate problem, which is the context within which both the financial crisis happened recently and now this particular health crisis. So the conditions could also be for the airlines, for example, which are going to be bailed out, they also become, you know, more green. Why not?
Okay, well, let's just put that to Harriet Baldwin. Harriet, specifically there, talking about airline industry, do you think there should be any climate change conditions attached to any bailout of the airline industry?
I think that in terms of the climate work, it's still very important to focus on the fact that we do need to get to net zero by 2050. Of course we do. We mustn't lose sight of that as we respond to this temporary crisis. But I do think that in terms of this bridge across the economic chasm that we're going to go through, that we do need to focus on making sure businesses are ready to get back and fueling our economy when we get out the other side.
Harriet Baldwin, I'm really sorry, but we're running out of time. I'm going to have to leave it there. And Mariana Mazzucato, thank you very much.
Germany, the most populated country in the European Union, has one of the lowest coronavirus death rates. It has 24% fewer confirmed COVID-19 cases per capita than the US. And the case fatality rate in Germany is also much lower. While 50 out of every 1,000 people with confirmed infections in the US have died, in Germany it's only 26. So what has Germany done right to fight the coronavirus? When COVID-19 first started to spread in parts of Europe, Germany took notice.
We could see what happened to the Italian population, we could see what happened to the Spanish people. So we were given some more time to prepare, and we were able to adjust our medical treatment, recruit additional ventilators, buying additional ventilators, and educating doctors and nurses to at least do basic ventilatory support.
By late February, large events started to get cancelled. And by March 22nd, gatherings of more than 2 were outlawed.
Es ist ernst. Nehmen Sie es auch ernst.
Germans invest more in their healthcare system than most other countries, and they have one of the most extensive public healthcare systems with national healthcare insurance for everyone.
Deutschland hat ein exzellentes Gesundheitssystem. Vielleicht eines der besten der Welt. Das kann uns Zuversicht geben.
Germany also has one of the highest concentrations of hospitals and a high per capita number of intensive care beds that are equipped with ventilators.
Something between 5 and 10% of the population who is infected and is ill will need respiratory support. And so it depends on the number of patients who are falling ill.
And in Germany, there is no shortage of life-saving ventilators needed to provide respiratory support, or staff needed to work those ventilators. One of the most significant things Germany did was early testing of its population for the coronavirus.
In the beginning, there was a clear indication only individuals that returned from China, later from Italy or from the skiing areas, plus they should have symptoms. Only those should be tested in order to not have too many. Then, when we had positive cases, the direct contacts were tested.
As of April 15th, Germany has conducted over 1.7 million tests via a widespread network of regional labs. The Gesundheitsämter, a collection of public health offices that exert rigorous controls, has played a significant role in documenting testing and helping prevent the spread of the virus.
They're counting and counting. They have to call the people also to put them in quarantine. But I think that network also works quite well. Testing plus registration and finding out, in the beginning at least, routes of transmission. Now it's getting too complicated. Not everyone can be followed up, but I think in the beginning it was helpful to contain the virus a little bit.
All these measures seem to be paying off. The number of new positive COVID-19 cases in Germany is trending down. Merkel has announced plans to gradually reopen the country's economy, starting with some retail stores, bookshops, and car dealerships on April 20th.
Jetzt ganz davon abhängen, wie entwickeln sich die Infektionsraten. Ich sagte schon, wir haben da nicht viele Spielräume und deshalb hoffe ich, dass alle weiter so mitmachen und die Regeln einhalten.
Testing is the basis for allowing these changes, and it's every day measured, and if it spreads again and if it really goes up again, then changes can be implemented again.
Restrictions are beginning to ease up, but Merkel warned that the loosening of restrictions in no way means the virus is going away.
Wir müssen verstehen, dass wir so lange mit dem Virus leben müssen, wie es keine Medikamente und insbesondere keinen Impfstoff gibt.
Germany, the most populated country in the European Union, has one of the lowest coronavirus death rates. It has 24% fewer confirmed COVID-19 cases per capita than the US. And the case fatality rate in Germany is also much lower. While 50 out of every 1,000 people with confirmed infections in the US have died, in Germany it's only 26. So what has Germany done right to fight the coronavirus? When COVID-19 first started to spread in parts of Europe, Germany took notice.
We could see what happened to the Italian population, we could see what happened to the Spanish people. So we were given some more time to prepare, and we were able to adjust our medical treatment, recruit additional ventilators, buying additional ventilators, and educating doctors and nurses to at least do basic ventilatory support.
By late February, large events started to get cancelled. And by March 22nd, gatherings of more than 2 were outlawed.
Es ist ernst. Nehmen Sie es auch ernst.
Germans invest more in their healthcare system than most other countries, and they have one of the most extensive public healthcare systems with national healthcare insurance for everyone.
Deutschland hat ein exzellentes Gesundheitssystem. Vielleicht eines der besten der Welt. Das kann uns Zuversicht geben.
Germany also has one of the highest concentrations of hospitals and a high per capita number of intensive care beds that are equipped with ventilators.
Something between 5 and 10% of the population who is infected and is ill will need respiratory support. And so it depends on the number of patients who are falling ill.
And in Germany, there is no shortage of life-saving ventilators needed to provide respiratory support, or staff needed to work those ventilators. One of the most significant things Germany did was early testing of its population for the coronavirus.
In the beginning, there was a clear indication only individuals that returned from China, later from Italy or from the skiing areas, plus they should have symptoms. Only those should be tested in order to not have too many. Then, when we had positive cases, the direct contacts were tested.
As of April 15th, Germany has conducted over 1.7 million tests via a widespread network of regional labs. The Gesundheitsämter, a collection of public health offices that exert rigorous controls, has played a significant role in documenting testing and helping prevent the spread of the virus.
They're counting and counting. They have to call the people also to put them in quarantine. But I think that network also works quite well. Testing plus registration and finding out, in the beginning at least, routes of transmission. Now it's getting too complicated. Not everyone can be followed up, but I think in the beginning it was helpful to contain the virus a little bit.
All these measures seem to be paying off. The number of new positive COVID-19 cases in Germany is trending down. Merkel has announced plans to gradually reopen the country's economy, starting with some retail stores, bookshops, and car dealerships on April 20th.
Jetzt ganz davon abhängen, wie entwickeln sich die Infektionsraten. Ich sagte schon, wir haben da nicht viele Spielräume und deshalb hoffe ich, dass alle weiter so mitmachen und die Regeln einhalten.
Testing is the basis for allowing these changes, and it's every day measured, and if it spreads again and if it really goes up again, then changes can be implemented again.
Restrictions are beginning to ease up, but Merkel warned that the loosening of restrictions in no way means the virus is going away.
Wir müssen verstehen, dass wir so lange mit dem Virus leben müssen, wie es keine Medikamente und insbesondere keinen Impfstoff gibt.